All right, we are back, and I am so excited to introduce Tara Taylor to you all. Taylor is coming in from the unceded territories of the Musqueam, Tsleil-Waututh, and Squamish First Nations, otherwise known as Vancouver. In general, if you get an opportunity to ever interact with Tara Taylor, you will be connecting to a massive network of grassroots level harm reduction activism. Tara's a badass, one of my favorite people to do work with and create programming. So excited to have them here today, and I'm going to leave and let Tara speak for themselves, and I'm out. Tara, if you need any help, you're on your own. I'm just kidding. I'll pop back in.
Perfect. Yeah, thanks. I guess if anyone ever needs an introduction, ask Una to do it, because like, how do you really even say much more about yourself, right? So, thank you. As mentioned, my name is Tara Taylor, and I'm coming to you all from the occupied and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. Thank you for having me. I guess like just a quick brief thing of myself is I'm involved with the MySafe Society, with the Overdose Prevention Society, and then the Spencer Creel Foundation, and a few other things in the downtown east side. Been doing the work down here with a focus on harm reduction and overdose response, I guess, lately, but for about 17 years. So to name that, I'm definitely in no means any kind of a tech wizard. In fact, probably later in this presentation, when I try to share a video, you may discover that even more so. But I am here because I'm excited to be a part of a lot of the initiatives that you all are part of, where we're combining a community that I hold dear to my heart with some tech to try to save some lives. And if you can't see my screen, let me know. If anyone needs to interrupt me because I'm not doing it right, just let me know. What is MySafe? Yeah, as it says here, Safe Supply Initiative formed in response to the overdose crisis. It provides people with a safer, regulated supply of opiates to prevent drug overdoses. It's a secure lockbox for participants to store medication. It's accessed by using biometrics, aka a palm scan, at prescribed intervals. Since we launched, we've had over 3,500 prescriptions been picked up. But like for me, what is MySafe? It's basically an empowering and dignifying way of dispensing safer supply. And most of today's presentation is the how, where, who, when. And at the end of this, we're going to show a quick video. And then we'll also, at the end of that, come back for any questions that I can hopefully help answer. How does it work? So really basically, somebody talks with the prescriber calls it into the pharmacist fills that.
Just going to interrupt you for 1 second. Your presentation isn't sharing, so if you can share your screen.
Yeah. All right, sharing screen, entire screen, share. Thank you for letting me know, because I was just looking at a PowerPoint that I assumed it was sharing.
And click on your, yes.
Is that working?
Yes, beautiful.
The only other slides you missed were just these two. Boom, that's what it is. And then now, how does it work? Thank you, Una. So yes, like I said, goes prescriber, pharmacist. Pharmacist fills the prescription. And then depending which community you're in, either somebody from the site that has the machine goes and picks up the medication, or the pharmacist takes it to the site, and then it's loaded very much like a vending machine, right? You think about when you look at a vending machine, you have different lanes and rows of product. So same idea of that. Once it's put into the assigned lane, the person on site then enters that into the dashboard to like update the inventory. And honestly, from there, you can pretty much run MySafe from any computer that has a Wi-Fi signal. So it has access to a dashboard that helps control inventory, accessibility, like are people receiving it a couple times a day, once a day, 4 times a day. And so that's kind of where it's like innovative is the facts of being able to run MySafe from many different places. Currently, MySafe is funded by Health Canada grant. So we have our first machine ever in December 2019, started in Vancouver at the Overdose Prevention Society. It was unfunded, pretty much volunteer run. After about a year and a bit of that, we were able to secure funding. Now we have a couple more in Vancouver. We just launched one in Victoria, and we're in the conversations with Nova Scotia and Ontario to launch a couple more over there. Basically, the only reason that we were able to start in Vancouver, and just as I always want to name, is just a lot of the radical activism that happened in Vancouver and the downtown east side. with, you know, the Bandus, the Bud Osbornes, the Anne Livingston, and I'm sure some other folks that have been named here today. So we were able to just kind of go with it, have it launched out of the Overdose Prevention Society, and then now people are following suit. So it's taking a bit longer back east because it's not the same supports happening over there from the health authorities, from the government and such. This is one of my favorite slides, right? It names it. MySafe saves lives, it saved mine. That honestly should be enough. That should be what we need to just keep moving forward. But unfortunately, we need a bit more, right? And some of the ways that I've seen MySafe be super successful is like when we started with the Overdose Prevention Society, which I'll just start calling OPS, we started to stabilize the staff there, right? So it's one of North America's, if not the most busy consumption site in North America. And we had a lot of our staff using substances while on shift. It happens all the time. But, you know, they were hitting the benzo. Once we started seeing benzo in our toxic supply, we had half of our staff overdosing and being out of commission for the rest of their shift, just putting a bigger strain on like the whole system itself. So we started getting the ops staff, some of the first folks getting into the machine. A lot of those folks are stabilized. They're still around, you know what I mean? Then secondly, we moved into working with the TIRA. We got a couple machines into transitional housing. And that's been a pretty big success in the sense that, you know, if you don't have to leave your home to go get something that's not going to make you sick, you might start making different choices, such as, you know, a lot of the women involved in survival sex trade, they don't have to work 7 days a week. They can access their medication as needed for days they might not want to go out, or, you know, just you're not feeling well. Or Kool-Aid, which is the one in Victoria, you know, it's like a transitional shelter. When the province started buying hotels, it became one of that. So the problem with Kool-Aid is it's not near any services. So if anybody needs to get to the pharmacy, it's probably going to be a good hour or two walk if they even want to walk there, or the pharmacist has to come to them. And then if you miss that pharmacist, then you've missed it for the day, therefore being pretty sick. So Kool-Aid being somewhat, you know, it's in a city, but it's outside of the centralized services, it's making it successful for people to access. A couple of the folks here, you know, Fester, he wanted to get his life back in order to a point that he could feel proud about himself and not feel like less than a human. Henry was one of our first folks who started accessing with the Overdose Prevention Society. He had reconnected now, once stabilized, reconnected with his family, has been like connected with the family continuing, has moved on to different places of employment, is using substances in a different way that's a bit more dignifying for what Henry was trying to get to. Here, so just spoke about a lot of the folks that are accessing the medications coming out of MySafe. Here's a list of some of the folks you might not hear as being supporters, but they are, you know, they're not necessarily the folks that I look to, such as the BPD or, you know, other folks within the BIA, but it is support that it shows, and it goes to show the scope of the conversation that's changing around safe supply. You know, and it's part of why I've been a part of it since 2019, is someone has to start the initiative and then someone follows it here. And, you know, like a lot of the folks on this call today or this meeting, what happened, something that we're on, are all like looking at other ways of responding to the toxic drug supply, right? And just like any good initiative, there's challenges. You know, despite that we've been proven to be clean, safe, we're successful doing all the things, the big challenges that we're seeing actually aren't really tied to tech. It's tied a lot to the public health leadership, you know, addiction physicians, all the different colleges, because it's kind of outside the box of how people were being accessing their safer supply, right? And so it's just like anytime something's new and you're trying to open something up a bit more, there's a lot of pushback from some of the older gents at the college of, you know, the physicians and pharmacists. But one of the reasons that it's still kicking and going around is, you know, it is also often things come down to dollars and cents. And so this is a cost-effective and scalable model. Just a couple of the points that I'll point out today, you know, at a medication delivery cost of under $10, MySafe is like cost efficient and absolutely scalable. Most of the pilot have been in people in urban centers, but, you know, we're always looking at ways that we could redefine and get it out to remote communities, right? Because that's where we're seeing some of the higher numbers of some of the remote communities and the smaller communities. So obviously trying to get there, you know, and the pilot project funding has allowed 5 sites to happen. And like we'd mentioned, I'm sorry, it's an old slide, but instead of Winnipeg, we're moved over into Ottawa. Like I said, like most of you here today, a lot of the initiative that we're moving forward with is in response to, you know, the toxic drug supply and the necropolitics of the systems that we're existing in. And some of the ways that MySafe is innovative, as we've named, but like it's also one of the first, what's the first of its national in the scope of addressing it by addressing it through different provinces, which has both been a challenge, but also been great to learn what's happening in other places. MySafe is the only safe supply initiative that continues innovative technology with programming to provide access to safer supply. So again, just like, the biometrics, the hand scan, I don't know, I think it's pretty cool. Scans your palm, 10,000 points. Something I didn't know is that everybody has an original in their own palm, right? So like a thumbprint or fingerprint, easy to make if you have tape. Even the eye, that's something I guess with new cameras, you can make it so that you can scan it. But so far, no, you can't. Everyone has a different palm, so that's like pretty cool. Once people find that they do not have to spend their days seeking money and drugs, there is a much higher likelihood that they'll seek the supports that they need. Basically, you can't help people if they're dead. And if what we're trying to do is support people in getting the support that they need, the stuff that they need, then there's a safer supply program that we need to supply them with. And this is one of the ones that it is. I'm not saying it's the only one, but it's the one that's working right now. The only ethical response in this situation is to at least give people an alternative of a safe pharmaceutical drug that they will not overdose on. And even moving past that, like we're looking at ways of to give people access to more than just the pharmaceutical, right? Like we just need to give people access to what they want. Start like learning on the fact and leaning on the fact that people are experts of their own lives, and start holding, physicians and health authorities accountable to like actually listening to the folks that are naming what they need. I know I talk quickly, but I think our message is pretty clear. It's all up here. And, it's on our websites and our social medias, but it's just a dignifying way of giving people access to safe supply. And again, just putting the expertise back on the folks who are asking for and needing a safe supply. Just wanted to acknowledge, I actually don't know if Dr. Tyndall's on the call today or not, but, like Dr. Mark Tyndall is among Canada's leading experts on harm reduction, public health, and the transmission of infectious diseases. As someone who's been downtown east side for 17 years, I've been witness to Dr. Mark Tyndall, have some of the harder conversations that needed to happen, not to necessarily pave a way, but to actually kick open doors so that other folks who are maybe not as established are able to start, responding and helping and stuff, but still it's not enough. And so one of our biggest barriers is named, it's not the tech, it's not the need, it's actually the prescribers, and we just don't have enough people prescribing safer supply. As mentioned, our partners, Atira, it's the two transitional houses in Vancouver. Solid, it was our first place that we landed outside of Vancouver in Victoria, which has now been moved to Kool-Aid. Acknowledging that I don't have Kool-Aid on the slide, my apologies. Ops, Overdose Prevention Society, which is where it all kind of started. Dispension, which is the company we work with back east, who helps us with all the software and machine stuff. Lots of names here that were some of the community supporters, continues to be, again, just really acknowledging some of the radical activism that's happened over the decades in Vancouver. Some of them are up here today. Also just want to thank Health Canada for giving us some funding. We are currently just starting into year 2 of a 3-year SUUP grant, which has given us the ability to scale up MySafe. Lastly, I guess we're just going to throw a thank you to everyone for listening and everyone for all the work that they're doing. I'm going to stop sharing my screen, and in a magic world, Dana or somebody is going to help play a video that we're going to watch. And then after that, I will come back for any questions.
I'll join you in the awkward silence as you stare out into the ether.
It just makes no sense to walk by somebody knowing they're going to inject something that could kill them and not offering them an alternative when we have an alternative.
So interesting. I got used to Zoom now, and I don't even really know where I'm looking at.
Really, the key criteria that we use for determining somebody's eligibility is, are they using street fentanyl? And as a consequence of that, are they at risk for dying?
So originally people were getting four times a day, but with COVID we were able to respond by changing that from 4 times a day, accessing the machine to 1 time a day, so they're able to get their full day with that.
This program's great. Like, where do you see, you can walk in, put your hand up to a machine and it distributes what you need, right? I mean, that's great.
I was one of the first persons through the program here, and in fact it's changed my whole life. Forming a great relationship with my grandchildren. I have an 18-year-old granddaughter that I've now been able to spend time with, and I'm not always running around looking to get well.
I used to have to wake up in the morning, do crime or something right away to make money. Right now, at least, I just know I can come here. It takes away the stress, kind of helped me stay out of jail, that's for sure.
And there's literally tens of thousands of people in the province who are putting themselves at risk by buying toxic street drugs. And so we need to come up with programs that can really expand. The last 5 years working down here has really been horrendous. Though we've done what we can to reduce the number of people dying from overdoses, the numbers say that we haven't done enough. It just makes no sense to walk by somebody knowing they're going to inject something that could kill them and not offering them an alternative when we have an alternative.
Really, the key criteria that we use for determining somebody's eligibility is, are they using street fentanyl? And as a consequence of that, are they at risk for dying?
So originally people were getting four times a day, but with COVID, we were able to respond by changing that from 4 times a day, accessing the machine to 1 time a day. So they're able to get their full day with that.
This program's great. Like, where do you see you can walk in, put your hand up to a machine and it distributes what you need, right? I mean, that's great.
I was one of the first persons through the program here. And in fact, it's changed my whole life. Forming a great relationship with my grandchildren. I have an 18-year-old granddaughter that I've now been able to spend time with, and I'm not always running around looking to get well.
I used to have to wake up in the morning, do crime or something right away to make money. Right now, at least, I just know I can come here. It takes away the stress, kind of helped me stay out of jail, that's for sure.
There's literally tens of thousands of people in the province who are putting themselves at risk by buying toxic street drugs. And so we need to come up with programs that can really expand beyond very structured medical models of giving people injectable heroin or injectable hydromorphone.
So we see up to 700 people a day at OPS getting a predictable dosage from MySafe for the folks that we see every day as saving their lives. We see lots of people overdosing every day. Once they get on this program, their life changes absolutely.
My personal experience dealing with pharmacists and having to be like moderated and told what to do is frustrating, and you feel like a little kid. And this puts it in your hands, how you want to deal with it, and limits the interaction and judgment that you would have to deal with going to a pharmacy.
How many people do you want to die before you decide that maybe hitting rock bottom isn't the best way for people to change? And it might seem counterintuitive to people, but giving them a safe supply of drugs is their first step towards reducing or not using, if that's what they want to do. And give them the opportunity to actually do that is, I feel, is the most important thing that I can do.
Excellent. We are back. So just so you know, we behind the scenes cannot see what you are saying in the front. So, you know, we have some mixing up that ends up happening as it is. Excellent. Tara, thank you for joining. Does anyone have any questions for Tara Taylor and the MySafe project? And why are you muted? I'm going to unmute you. Can you unmute yourself?
I didn't even realize I was muted. Yeah, I can unmute myself. Thank you.
Excellent. Let's see. Other than someone commenting that we have some good hat game today, I don't see any questions in the chat. But I was wondering if you might be able to give us just a quick walkthrough, what's the flow? So in between someone getting prescription, how do they, like, what do they do?
Yeah, so someone would come to us and let us know that they maybe want to be a part of MySafe. And so we have a bit of an intake process, just checking and making sure that they're eligible. And really the only thing that wouldn't make them eligible is what we're prescribing is Dilaudid 8. And if that were to mix with somebody else's medication is kind of the only thing that would ever. And the only other real requirement, are they at risk of overdose? Literally everybody. So yeah, so that it's not that hard to get to the point of doing an intake form. We connect them with our prescribing doctor, which is currently only Dr. Mark Tyndall right now, always looking for other prescribers as well. And then once that all goes through, the prescription goes in and then we get it into the machine. And that's kind of how people would become part of the flow. And then we just have, because it is a Health Canada grant, lots of different check-ins and interviews throughout to make sure that it's working. Do they need more medications? And even just seeing some qualitative and quantitative, what is working and what isn't, and what are some of the benefits of it.
Awesome, thank you. Megan is asking, have you gotten pushback from people in the community?
Have we gotten pushback from people in the community? Not totally sure I understand the question, but I'm going to try to answer it. If not, definitely ask a bit more, but we have not. So people who are selling substances have not had a problem with us being a part of this. Folks who are accessing it, no pushback on that. Honestly, the only pushback we're getting is from the College of Physicians, the College of Pharmaceutical, mostly, just to name it, like old white dudes in power who don't like a new way of responding to a toxic drug supply. But as part of this community, absolutely not. People want to be a part of it. Dilaudid 8s, people are asking for other things, so now working with Health Canada to maybe respond to bringing other things into the machine. But for those who are accessing it, it's working for them.
Amazing. Kelly is asking, how did you decide on the palm scan, and how did folks respond to it initially?
Yep. So the palm scan was, at the time, I think it still is, the only thing that's not replicated in order to access. So like I was saying, if you have like a good piece of tape and you take a thumb, you can put that against a screen and that can be read as a thumb. Same with like an eye scan with some of the newer like computers or cameras or whatever on phones, you can replicate that so people are able to access this. But with the palm, no one's been able to access that. So lasers somehow shoot out of the palm scanner into 10,000 points of your palm, and we scan it a few times. So it's like layer upon layer upon layer. So no one's able to replicate anybody else's palm at this time. You also need an active palm. Like it can't just be a palm that doesn't belong to somebody anymore. So like it's like at this time it's unavailable for people to get around. That was a nice way of putting that. Yeah.
I love that so much. Okay. A couple more questions. Megan says, restated the question, referring to people who think that it brings bad people to their neighborhood, things like that. This is in relation to, is there community pushback?
Currently, all the machines are in neighborhoods that I guess you would already have those people in. So we're not bringing anybody into neighborhoods at this time. So I wouldn't be able to respond to that. But yeah, all the machines are in the downtown east side of Vancouver, or what would be considered the downtown east side of Victoria.
Reese is asking, are there any concerns about anonymity for users?
So Reese, just make sure I understand that at this time not. It's like, so the way that there's a whole bunch of security on the back side of it all. So basically in the machine, it's just somebody's number, their badge number, and their lane. So there's no way to know who that is tied to unless you have access to the back portal and the dashboard. And even that, as the operations manager, I have access to some of it. So I know their name, I know their birth date kind of thing, and that's all how we're able to decipherate. And then Dispension and Signify, the two tech people and machines people on the backside, they have even more information, but it's all kind of blocked off, so no one has access to everybody. I hope that answers what he was getting at. They were getting at.
Awesome. Tara, thanks for taking time out from your extremely busy, zesty, and incredibly creative and complex life to spend some time with us today and show off some of the amazing things that you are doing and bringing to the surface. And as always, I love sharing space with you, and I hope to get to see you in real life real soon.
That sounds lovely. Thanks, everybody.
Bye.